So for the geriatric age like that, we just try to, as pharmacists, we try to make sure the people that are taking care of this age group are well informed and then taught how to make use of this teleconsultation and all.
For pharmacies, we've been acting as best we can to protect our senior population. It's typically the population that we service most.
But many of the other retail stores are offering special hours just for seniors. So early mornings after everything's been cleaned and done like that.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
This episode will focus on one of the most at-risk populations during the COVID-19 pandemic. The elderly, or geriatric population, has been widely affected, with a significant number of infections and deaths reported worldwide. Pharmacists are involved in geriatric care on a day-to-day basis, ensuring they have access to the medications they need while educating on any chronic health conditions such as hypertension and diabetes. During the pandemic, pharmacists have stepped up their efforts to ensure the elderly remain safe and healthy. Let's hear from the pharmacists about the services and care they provided to seniors during the past few months.
For pharmacies, we've been acting as best we can to protect our senior population. It's typically the population that we service most in a community, and I think some of the ways that we discussed earlier, whether it be promoting delivery service so that we can help those seniors stay at home and avoid going out. A lot of pharmacies, including our own, especially early on, started out with seniors only shopping hours in order to provide a safer space for them. But and again, I think what we're seeing too is maintaining curbside pickup and delivery. Those are, all elements. And I think we're also trying to work on things like, virtual care, which isn't necessarily easy for all seniors. We're surprised at how many seniors are, very tech savvy. And we also have to be mindful that there's a number of seniors out there that haven't embraced technology, and we have to figure out a way to be able to interact with them. And there's other considerations, whether they may be, hard of hearing, so they rely on that face-to-face communication. I think we've got a long ways to go to really understand how we can fully support them. But I think we can also be proud that we've, taken measures to keep them safe largely. And now that, again, case numbers have declined significantly, hopefully it will allow each province and the country to develop a strategy to be able to test and trace appropriately, so we can start to return to normal, but also to keep our senior population safe.
So they are, as you mentioned, the most significantly impacted age group within this pandemic, and certainly have been significantly impacted here in Canada. I would say the vast majority of the casualties and the deaths from COVID-19 here in Canada are from the elderly population, particularly those in long-term care. And so that's where we've seen the largest impact of this pandemic, is really in long-term care homes. And so the frail elderly who are there are significantly at risk. And pharmacists, what we've seen is pharmacists do provide clinical services to long-term care homes, generally speaking, from a community pharmacy perspective. That's just the way how it works in general. But what we've seen is that some hospital pharmacists and pharmacy technicians have chosen to be redeployed from their frontline pharmacist positions or technician positions in hospital to actually go into long-term care homes and help out there in any way they can. Not necessarily in the role of a pharmacist or a pharmacy technician, but even in the role of, a helper, an aide, a PSW, to help with the patients, to get them up, to help them with meals and whatnot. And so pharmacists have certainly stepped up to the plate to be able to assist those patients. And we also look at, again, optimizing medications to reduce the risk of exposure. Looking at, are there ways that we can, are there things that we need to consider in the population the elderly population, in terms of side effects from medications, and what impact will that have if they get COVID, or, will their side effects mask certain symptoms? And so certainly pharmacists are involved there.
So it definitely hit the senior population hard. I think, if people, in that category, they probably need to be the ones that are most sensitive to, wearing masks and, social distancing. And, you might not think that you need to wear a mask, but, you might have elderly parents or people from that, vulnerable group. So if you don't wear a mask one day when you go out to the grocery store and then you go see an elderly person, well, that could be transmission right there. Right. So it's important for all of us to kind of practice, social distancing and those safe measures, because you never know when you're going to encounter or interact with people that are vulnerable, like the elderly. So from a pharmacy perspective, we wanted to make sure that we were always available for our most vulnerable patients, so our seniors, people that are immunocompromised, offering them, safe delivery, so that, there's minimal contact with their delivery packages, offering them like delivery 6 or 7 days a week. If they even couldn't come in on Sundays, we made sure we had some kind of mechanism to get them the medications on weekends. Availability over the phone for any questions, having like an emergency line for our patients to call us after hours if needed. So these are some of the things that we did from a pharmacy perspective.
Absolutely. That was why the panic spread quite quickly in a few days after the COVID appeared on the mainstreams, because we are an elderly population, and since the news that the elderly population was the most hit by the COVID, you in a few days you saw young people under 50 years old were the only one allowed. There was a lockdown, initial lockdown for over 65, and they were the most who need cares. I mean, they need to take their medications, but they had no opportunity or to go to the pharmacy. So we have to really activate in few days a huge home delivery, and thankfully our government set up in a very efficient way the digitalization of the prescription. So people have no. The people had not to go to doctors anymore, to doctor studio. They simply had to send someone or call the pharmacy, give their social tax number, and from there we could see all the prescription made by the doctor, prepare the drugs, and deliver them directly home, because no one was allowed to over 65 to exit their homes.
When this first broke out in March, the majority, a lot of pharmacies in the area actually closed their front ends. We closed the front end of both of our stores for about 6 weeks because unfortunately it was our geriatric patient that was the most resistant to staying home or masking up. They think that they're untouchable, and they don't want to have to comply with those sorts of things. So after a couple of days of understanding that we were not going to get them to stay home or out of the store, we closed the store up front, and we ran out of the drive-through only. to minimize their contact. Most pharmacies in the area will offer delivery and mail out for the seniors. Many stores in the area, not necessarily the pharmacies, but many of the other retail stores are offering special hours just for seniors. So early mornings after everything's been cleaned and done like that, they have, vulnerable population shopping hours such that they can keep the exposure lower. And then most of the nursing homes and such, residential care for seniors are pretty much working on lockdown situations at this point. Really nobody in who isn't necessary, just to reduce, because as we saw here, the first real outbreak happened at the Life Center in Kirkland, and that was pretty tragic.
Yeah, so I think the pandemic has had several impacts, several negative consequences, especially for our older patients or older adults. And they range from isolation at home to potentially not having optimal management of chronic conditions such as hypertension and diabetes, to potentially creating access to medication barriers that they didn't experience before. Many older adults were concerned about visiting the grocery store, visiting the community pharmacy to pick up their medicines, to buy groceries. And so that created a lot of angst and anxiety around contracting coronavirus. And many grocery stores, many pharmacies created special hours for our seniors to be able to go first thing in the morning, early in the morning, so that they had less exposure to potentially contracting the virus. Our pharmacy students at UCSD really stepped up to the plate and created a volunteer service for meal deliveries, for grocery deliveries, to help older adults with medication access. So they actually received donations from many people in the community, including even their professors like me, and they purchased PPE for older adults, face coverings for them to have at home. They did grocery store visits and were able to provide that. And then most recently, they've partnered with our student-run free clinic program to be able to provide free groceries to those who are underserved or may not have the resources. So it's truly something that's heartwarming and shows the generosity, the compassion, and the care that healthcare providers have. And even in a time when you can't necessarily, the poor students couldn't even go to rotations, they were still out there taking care of the community.
How our government did it, when they sort of implemented the lockdown, they sent out criteria for what they called it, people who should be shielding. So these are people who should have ideally no contact with anybody at all, including sort of members of their own household, unless of course the members of their own household aren't going out either. And within that category, there were various people with chronic diseases, immunosuppressed patients and all that sort of thing. And over 75s, as a blanket rule, were put into that category. That was a little contentious because obviously you can get perfectly healthy over 75-year-olds versus 50 and 60-year-olds with multiple comorbidities. But I think that was a pragmatic decision that was made early on. We fortunately had maybe 2 weeks to learn about this virus before it really sort of kicked off, I suppose. There wasn't a lot of data coming out of China that we could use and implement, aside from seeing about how they did lockdown. But the Italian population, particularly in the northern region where it really probably first hit Europe, was a very elderly population in that area. And that there was a suspicion that because sort of compared to a normal city and a normal area of the world, they had a much higher elderly retired population. That was why it was so bad there so quickly. And so I think that's where that information came from. So the idea was from sort of about the 20th of March, elderly people don't go out the house, everything is delivered and all that sort of thing to you. So lots of local networks were sort of set up to make sure those people were being supported in their own homes, food deliveries and all that sort of thing. And one thing the government did set up was a volunteer-led pharmacy delivery service. So healthy individuals could volunteer to do delivering of medication to all these people in their homes, and that could include things they're buying over the counter as well as their prescription medicines and all that sort of thing. And there was quite a sort of a national drive to support the NHS being I suppose it's a bit different because it's all government funded, so it's very much in the public hands to support it, and it was more of a national effort type, I think, way in which they did it. Say, oh, we're all working together, we're all supporting each other, we don't want the NHS to get overwhelmed by what's going on, which means we need our elderly people to stay home because these are the people that are going to end up in hospital, end up on ventilation, end up at a higher risk of dying from COVID if we don't put in those safeguards for them. And so I think from a pharmacy point of view, it was very much like the rest of the national picture. It was supporting them so that they didn't have to go out of their own homes, so that they could have consultations, queries, everything in their own environments, and they had access to professionals if they needed it.
Creo que la principal población que es afectada es la población geriátrica. En Ecuador, forma global y como experiencia en Europa, lo puedo comentar, los brotes en Europa eran causados por fiestas clandestinas que se reunían jóvenes y como son asintomáticos llevaban la enfermedad, y los primeros en caer eran pacientes geriátricos, pacientes mayores, pacientes que estaban en casas de residencia. En general han sido los más afectados, y en Ecuador la historia no se sigue pintando igual. La campaña acá es esperar que mayores de 65 años no salgan lo menos posible, porque aún tenemos el virus, aún la transmisión sigue siendo comunitaria y aún no llegamos a una meseta. ¿Qué pasos estamos tomando los farmacéuticos para asegurar que las personas mayores sean atendidas? Pues fuera de hospital y centro de salud, ninguno. Soy muy claro en esto, ningún paso se está dando fuera de hospitales. No hay campañas por parte de los farmacéuticos, es una parte en contra que tenemos en Ecuador, pero dentro de hospitales lo que se hace es el abastecimiento a hospitales, que es el propio trabajo que el farmacéutico debe cumplir en hospitales y en centros de salud pequeños, pero de forma centralizada, de forma directa a pacientes de este tipo, en realidad no se está haciendo absolutamente nada.
Okay, so for the geriatric age group, many of people in this age bracket actually have comorbidities. They have either hypertension, diabetes, or some other form of illnesses. So we are trying to ensure we reduce the way they get exposed to the hospital areas. Do you understand? Just to avoid any form of getting infected. So basically what we have tried to do in Nigeria is to embrace the technology and then make use of telemedicine, teleconsultation. So there are set of people or organizations that have come together to utilize this telemedicine and teleconsultation. So for the geriatric age like that, we just try to, as pharmacists, we try to make sure the people that are taking care of this age group are well informed and then taught how to make use of this teleconsultation and all, just to make sure we do not make the old get in contact with hospital areas or where they can easily get infected. And then we've also used made use of this home deliveries of medications to patients. So once a patient has a prescription for maybe for a refill, maybe an antihypertensive or anti-diabetic agent, like a refill medication, you just present your prescription to the pharmacist. Pharmacist assesses the prescription and then fills your prescription. And then we have people that help in transporting those prescriptions to the patients in their homes so that they don't really have to come out or get themselves exposed to the virus.
Okay, so for this group, as we know, they are more vulnerable as what you have rightly pointed out. Also, most of them may have chronic diseases that may prone to more complications if they are infected with COVID-19, you know. Yeah. So this group of patients generally in Singapore, they are not encouraged to come out at all. You know, they should stay at home, and there will be some organization to help handle their daily living should they need grocery help. So, you know, and there'll be a telehealth or some other help, and they are not encouraged to come to the hospital for treatment if they are stable, and that is where the teleconsult comes in handy. And our medical side, medical doctors, we have started a teleconsult. Our pharmacy side has also started a teleconsult for some of the clinics that are run by the pharmacists. So all this will actually reduce the exposure of the geriatric populations coming out to the society or the community, you know, that, you know, just to cut down all their exposure, to reduce the risk. Yeah.